It only opened just over a year ago, but already Bruny Island's multi-million-dollar health centre is in turmoil. More than half of the centre's nurses have left, and there's concern lives will be put at risk if proposed changes to services go ahead.
Bruny Island resident Barry Weston has only a few years left to live. The 61-year-old has terminal cancer as well as a serious heart condition. His wife Megan is concerned that life-saving heart medication has been removed from the island and says health services are disintegrating.
My concern would be if Barry had a heart attack, I don't want him to die. I would like to be able to know that somebody's here to administer a heart drug and that it hasn't been removed from the island for cost-cutting purposes.
In the past 2 years, the island's pool of nurses has dropped from 17 to 8, and several of those are on stress leave. It's understood the health department's considering making volunteer ambulance officers with only basic first aid training the first port of call after hours. That's traditionally been the job of nurses. Some residents are so concerned about health services, they're selling up and moving off the island.
They have made the decision to sell up and move to mainland Tasmania because they know that they can't expect the level of health assistance that we've had in the past.
The worst case scenario is that the nurses don't have the drug to administer and that patient dies, or that they send out the ambulance and by the time the nurses are informed, again, the patient dies.
The health centre opened 12 months ago and cost taxpayers $3 million.
We fought for this state-of-the-art centre. We've got it, but they're withdrawing all the nurses and everything else that goes with that centre.
I don't want someone to die needlessly. Who bears the cost of that sort of death?
A community meeting's being held this weekend and all sides of politics have been invited. Unions have also intervened.
It's about people's health and well-being, so you know, and I've talked to the department, very difficult to get anything done. They really need to you know, get off their butts and fix this.
The health department says it's listening to residents' concerns and is working with them on the proposed changes. Tamara Glumac, ABC News, Bruny Island.